When you are discharged from the hospital, your family doctor will manage your care. You will need to make the following appointments. Please book an appointment to see your family doctor within a week of being discharged, your cardiologist within 4 weeks of being discharged, and the cardiac surgeon within 8 weeks of being discharged. You can find the surgeon's phone number at the back of the heart surgery book. Write down any questions you may have before your appointment and bring them with you. You will be given a cardiac discharge summary on your day of discharge. This document outlines everything that happened during your hospital stay. Please bring this with you when you see your family doctor or if you have to go to the emergency department for any reason. If you live out of town or rurally, you can discuss the possibility of arranging a teleconference with your heart surgeon for your 2-month follow-up rather than making the trip back to Kelowna. Speak with the cardiac surgery office to see whether this option is available to you. Cardiac rehabilitation is an integral part of your recovery after cardiac surgery. Cardiac rehab includes education, monitored clinical exercise sessions, and counseling, all designed to help your recovery after a heart attack, surgery, or a diagnosis of a heart condition. Research shows it can help you regain strength, prevent your condition from worsening, and reduce your risk of further cardiac problems in the future. Along with community-based or video conferenced education sessions, some programs offer a series of guided exercise sessions to help you build your exercise tolerance and confidence in a safe environment.
One of the things I liked about it was we're keeping track of our progress, and did it take me less or more time to do a certain amount of distance on the track. And so it's actually measurable, where I could say, oh, I feel so much better, that's great. But when you have a look and you go, oh, and not only do you feel better, but you're doing that same distance in 2 minutes less over the last 4 weeks. Also for me, having the weekly session, it's sort of like goal setting, where you have to go back and report. Well, I had to go back and not only report, but demonstrate that I was doing better. And for me, for a person like me, and especially for me, having somebody that I had to answer to was most helpful. Not as necessarily answer to, but report to was most helpful. And they were great, just great. I had a couple of spots, and I'm pretty sure that I'm not unique in this regard. I had a couple of spots during the rehab program where I was getting some symptoms, and they said, hang on for a month, we want to get you in and have scans done and all of that. It worked out. It was just normal healing going on, but they were very, very cautious about what was going on with me post-surgery, which was great. My wife often remarked at that. They sure are looking after you after your surgery.
After discharge, you will be referred to cardiac rehab. You will be contacted 4 weeks after surgery. Typically, open heart patients attend an initial assessment 5 to 6 weeks after surgery. The education and exercise programs are typically 4 to 8 weeks in length. However, there is the option to only attend an assessment. If you have not heard from your region's cardiac rehab program within 1 month, please call the Coach Cardiac Rehab Clinic in Kelowna. The number is listed in your heart surgery book.